Good evening, colleagues and friends, and thank you for tuning in this evening for the 2022 State of the School Address for the Kirk Kerkorian School of Medicine at UNLV. We apologize for starting a few minutes late due to technical difficulties. However, it is my extreme pleasure to welcome Dr. Marc J. Kahn, Dean of the Kirk Kerkorian School of Medicine and Vice President of Health Affairs.
Good evening, everybody, and welcome to the 2022 State of the School Address. Boy, do we have some exciting things to report. As Dean of the Kirk Kerkorian School of Medicine and Vice President for Health Affairs for UNLV, it's my pleasure to be with you tonight to acknowledge and celebrate our many accomplishments over the past year and share a vision for our next 12 to 18 months. I should tell you that my 2-year anniversary is marked on this Friday. I really would like to thank my colleagues, my coworkers, and my friends for making this not only enjoyable, but a very productive 2 years. So at the School of Medicine, we continue to focus on our mission of serving our patients, students, medical professionals, and the community as a transformational force for improving the healthcare in Nevada. We're taking a 4-pillar approach. One is education, one is research, one is patient care, and the fourth is community engagement to fulfill our mission. Our mission, again, is simple. Our mission is to care for our community, and that's why we're here. I'm going to touch on all 4 of these areas this evening, but first I would like to wish all of our faculty, physician, residents, and fellows a very happy Doctor's Day. Doctor's Day is an annual observance aimed at appreciating physicians who help save our lives everywhere. The holiday first started actually in 1933 in Winder, Georgia, and since then it's been honored every year on March 30th. Next, I would like to recognize and thank the school's leadership team, for whom I would not be able to do my job each and every day. First, Dr. Neil Haycox, Vice Dean for Academic Affairs and Education. Next, Dr. Allison Netsky, Interim Vice Dean for Clinical Affairs and Chair of the Department of Psychiatry and Behavioral Health. Ms. Joanne Strobe, Executive Associate Dean for Administration and Finance, Chief Financial and Operations Officer, and Interim President and CEO of UNLV Health. Dr. Mark Guadagnoli, Senior Associate Dean for Faculty Affairs and Chair of the Department of Medical Education. Dr. Laura Cully, Associate Dean for Community Engagement. Dr. John Files, Associate Dean for External Affairs and Chair of the Department of Surgery. Dr. Michael Gardner, Associate Dean for Strategy. Dr. Mario Gasparda Alba, Associate Dean for Diversity, Equity, and Inclusion. Dr. Robert Hernandez, Associate Dean for Student Affairs and Admissions. Dr. Kate Martin, Associate Dean for Graduate Medical Education, and our designated institutional officer. Mr. Ron Bates, Assistant Dean for Finance. Dr. Johan Bester, Interim Dean for Biomedical Science Education. Dr. Sarah Hunt, Assistant Dean for Behavioral Health Sciences. Dr. Deborah Cools, Interim Assistant Dean for Research. Dr. Alyssa Palmer, Interim Assistant Dean for Continuing Education and Chair of the Department of Family and Community Medicine. Dr. Gary Shen, Assistant Dean for Clinical Education. Dr. Corinne Sullivan, Assistant Dean for Curriculum. Dr. Ross Berkeley, Chair of the Emergency Department. Dr. Buddha Dawn, Chair of Internal Medicine. Dr. Michael Dobbs, Chair of Orthopedics. Dr. Robert Wong, Chair of ENT, Head and Neck Surgery. Dr. Evelyn Montalvo Stanton, Chair of Pediatrics. Dr. Richard Benosa, Chair of Plastic Surgery. Dr. Nadia Gomez, Acting Chair of the Department of Obstetrics and Gynecology. And finally, I'd like to recognize Dr. Randy St. Hill as the Interim Chair of the Department of Surgery. Now, you may have noticed I announced 2 chairs for the Department of Surgery. After 26 years of service to our community in Southern Nevada and the Nevada system of higher education, our friend and colleague, Dr. John Files, has announced his retirement effective May of this year. Prior to joining the Kirk Kerkorian School of Medicine, Dr. Files was already an international renowned trauma surgeon, researcher, educator, and administrator. He was a University of Nevada, Reno School of Medicine faculty member. He was the inaugural chief of trauma surgery and chair of the Department of Surgery, which was actually based here in Las Vegas. He established the first American Association for the Surgery of Trauma approved fellowship in acute care surgery in the nation and served as its program director for over a decade. He served as the medical director of the Trauma Center and chief of the Department of Trauma and Burns at University Medical Center, our primary teaching hospital. He was a prominent leader in the medical response to the October 1st shootings and was actually truly a hero during those tough times. As a member of the Kirk Kerkorian School of Medicine, Dr. Fildes has served many roles. He's a professor of surgery, chair of the Department of Surgery, the Associate Dean of External Affairs, and Dr. Fildes served as the interim dean of the school from September 2019 to April 2020, right before my arrival. Despite his pending retirement, Dr. Fildes' legacy will live on at the school through the John Fildes, MD, Award and Lectureship Endowment, which he established to provide an annual award to an outstanding surgery resident or fellow, with the hope it will grow and be able to support the hiring of additional lecturers and faculty for the Department of Surgery. Please join me in thanking Dr. John Fildes for his generosity, for his spirit, for his enthusiasm, and for sharing his many talents with the Southern Nevada community, and more specifically with the Kirk Kerkorian School of Medicine. On a personal note, Dr. Fildes has been a mentor, he's been a friend, and he's made my transition to deanship much easier. Dr. Fildes' gift to the school is one of many examples of the support we've received not only from members of the UNLV family, but from the community as a whole. Over the past year, if you've driven through the Las Vegas Medical District, you've been able to watch the tremendous progress on the development of the Kirk Kerkorian Medical Education Building. This is a generous gift from the Nevada Health and Bioscience Corporation and its generous donors. The Medical Education Building is privately funded. It will be 135,000 square feet, and it's going to be a state-of-the-art medical education building. It's valued at about $150 million, and it's expected to be completed late summer, early fall. This is really going to change the way that the Las Vegas Medical District works, and hopefully will help us transform the local economy with private investment. This is going to be the face of our school. This is an important first building for our new School of Medicine. We've also received multi-million-dollar department chair endowments. So first came the Optum Dr. Tony and Renee Marlin Endowed Chair in the Department of Orthopedics, a $2.5 million endowment funded by Optum Care Nevada, the state's largest multi-specialty medical group, and Dr. Tony Marlin, the former chief of cardiology at UMC, who founded Sierra Health Services, which later became part of United Healthcare. Dr. Marlin and his wife have been true supporters of the School of Medicine since its inception. We thank them for their support. Dr. Michael Dobbs, professor and chair of the school's Department of Orthopedics, has been named as the first endowed chair. Our second endowed chair came from Intermountain Health Care of Nevada, and this is an endowed chair in obstetrics and gynecology as a result of a $2 million gift from Intermountain Health, a nonprofit healthcare organization which is ranked in the top 5 U.S. health systems for quality, cost, and innovation. Even before I got here to UNLV and Southern Nevada, I knew of the importance of Intermountain Health. I knew about their commitment to patient safety, to quality, and to value-based care. Dr. Nadia Gomez is currently serving as the acting chair of the Obstetrics and Gynecology Department as we undergo a nationwide search for this endowed chair. Certainly, this endowment will help us recruit a top-notch person to lead our Department of Obstetrics and Gynecology in the future. But the generosity doesn't stop there. Members of the school, UNLV Health, and the community continue to give through various campaigns, such as the White Coat Campaign, Rebels Give, and Reach Out and Read campaigns, to name a few. Others have sponsored scholarships, newly created gifts, and even ongoing contributions through payroll reductions. The support we continue to receive both internally and externally is a testament to how far we have come and the continued faith in which we are going and how much more we can do with appropriate resources. Speaking of which, another resource we've been extremely successful in leveraging to assist us in our mission to care for our community as a transformational force for improving healthcare in Nevada has been grant funding. In 2021, we were awarded 18 grants totaling over $6.5 million in funding. And to put that into perspective, that's 27% of the total grant funding the school has ever been awarded since its inception. We received this 27% in really just 1 year. In 2022, the Las Vegas City Council approved a plan that provides the School of Medicine $6 million in American Rescue Plan Act funds to go towards the construction of a biomedical research facility. Additionally, the city provided $4 million for the planning and design of a new ambulatory care facility. This will be state of the art. This will allow for coordinated care, and this will change the way that we practice in Las Vegas. Again, part of supporting our mission to care for our community. That's not to mention the other ARPA funding that's been awarded for other projects. Funding through philanthropy, grants, and other sources are really critical to ensure the school's success and the delivery of education, research, patient care, and community engagement. And we've been successful and continue to improve in all these areas. So now it's time to talk about our pillars. Again, to put it into perspective, that's education, that's research, that's clinical care, and it's community engagement. Let's start with education. After all, a school of medicine is here to educate the next generation of physicians. Well, it's been an exciting 12 months since my March 17th, 2021 State of the School address. That was just days before our charter class celebrated our first match day. Remember, match day is when students across the country find out where they're going to undertake the next part of their medical training, that is their residency. We have now celebrated 2 match days where 100% of both graduating classes have matched into programs. 38% of our graduates are remaining in Nevada for their residency training. Now, I'm really happy with that number. I certainly wish it was higher, but you need to understand that we don't have enough medical residency training programs here in the state of Nevada. We're working as an institution and working with our hospital partner, UMC, to increase the number of programs and positions that we have. We hope to have more programs in the future, but 38% is certainly a respectable number. Now, the 62% or so that chose to leave, we very much want to get them back. And students matched into some of the top programs in the country. On the other side, we welcomed 84 residents to the Kirk Kerkorian School of Medicine in 2021, including our charter class medical students who match with us, and we're looking forward to welcoming another 84 who matched with us earlier this month. These medical students come from all over the country. We know that about 70% of residents and fellows stay where they do their residency and fellowship to eventually practice. Again, our mission to serve our community is a mission to increase the number of doctors for our region. Through residency programs and through such training, we're really able to do this. Matt, according to the American Association of Medical Colleges, again, they say 57.1% of the individuals who completed residency training are going to stay in that state. And again, we want to make that a higher number. The Physician Workforce in Nevada chart book published in January 2022 shared similar findings that in our state, 55.2% of physicians who've completed graduate medical education training in Nevada continue to practice in the state. This number, though, however, jumps to almost 80% for physicians who complete both undergraduate and graduate medical education in Nevada. As we move forward, we're going to slowly, hopefully, increase the size of our medical school class. We're going to hopefully work to expand residency positions and offerings in our state, again, to satisfy our mission to train doctors for our state of Nevada. The more residents we bring, the more we're able to keep. And that's really going to be important to increase access for our community for state-of-the-art medical care. I'd like to share a brief recap of our charter class match day celebration, which took place just 2 days after my State of the School address last year. And just a week and a half ago, on March 18th, we celebrated our second match day with the class of 2022. Let's take a look at that event. So I'd really like to thank the student affairs team and other members of the school and university who came together to make these events so successful. If you've never been to a match day, you ought to try to come to our match day next year. They're always the third Friday in March, and they're always a cause for celebration. In addition to match day, we also celebrated our first commencement, really a historic event for our city, for our community, and for the university. We also had our first academic hooding ceremony with our charter class. While some celebrations were still limited and we did need to restrict attendance, we were excited to celebrate this milestone in person, even if socially distanced. The ceremony not only celebrated our charter class, but was the first big reveal of our new name, after the Nevada System of Higher Education Board of Regents approved the Kirk Kerkorian School of Medicine at UNLV name during their April 2021 board meeting. Let's take a moment to watch a few commencement highlights. So as the pandemic becomes endemic, we're starting to see great reason for optimism. Thus far, I hope that you realize how exciting things are at the Kirk Kerkorian School of Medicine and how excited we are to help to try to transform healthcare for our region. We can now engage in in-person education, patient care, and we can get back to a more normal quality of life. For example, the psychiatry and behavioral health course changed to team-based learning in 2021 with great success. All faculty participated in a clerkship boot camp to ensure a smooth transition for the students that had reduced patient contact due to COVID. The Couple and Family Therapy graduate program that reports through the School of Medicine had a very strong recruitment and graduated 25 students in 2021. The faculty mastered the online and hybrid curricula, and the clinic continued to serve clients with telehealth options to avoid any disruptions in patient services. Our graduate medical education programs continue to flourish, welcoming talented residents and fellows to train with our accomplished faculty and to provide much needed services to the Las Vegas community. I think we need to especially call out those residents and fellows who worked in intensive care units during the height of the pandemic. These individuals were subjected to really significant stress with large numbers of critically ill patients, death rates that exceeded those that they had seen in the past. But they persevered, they cared for our community, and importantly, patients under our care at UMC had higher survival numbers than those for the rest of the United States. And that's really testament to our partnership with UMC and the quality of our physicians and residents and fellows. We now have 322 active residents and fellows in 22 residency and fellowship programs. The new Pediatric Emergency Medicine Fellowship welcomed its first UNLV Pediatrics emergency medicine resident to the program, a program that will be 80% women, in fact, in the 2022 academic year. We're also developing a new program in forensic pathology in partnership with the Clark County Coroner's Office, and we're exploring other potential partnerships to expand our ability to support the Southern Nevada community that's been so supportive of us. In fact, the number of funded residency positions are funded for the Centers for Medicare and Medicaid Services. The number of funded residency positions in the United States has been virtually frozen since 1996. Recently, Congress has enacted a law that allows for expansion of 1,000 more spots throughout the country. Our team, led by Dr. Kate Martin and Dr. John Files, have applied for additional programs, recognizing the significant need we have right here in Southern Nevada. Bringing graduate medical education, that is residents and fellows, and undergraduate medical education, that is our medical students together, the family and community medicine and obstetrics and gynecology faculty and residents have trained and certified another class of our medical students in basic life supports in obstetrics, thanks to the financial support of the Women's Health Associates of Southern Nevada. Family and community medicine and OBGYN faculty have collaborated to train and certify first-year family medicine and OB-GYN residents in advanced life support and obstetrics, and offer this training to other family medicine residents throughout community training programs. Opportunities to extend continuing medical education to faculty, residents, and community practitioners have continued with the Kirk Kerkorian School of Medicine at UNLV. Grand Rounds updates and advances in clinical and investigative residence and medicine series. This has been led by Dr. Alyssa Palmer in collaboration with the Internal Medicine Department. Dr. Palmer was also successful in receiving grant funds to expand the CME program with the school, including Project ECHO. I'm happy to announce that we have been approved for both Alpha Omega Alpha, the National Medical Honor Society, and Gold Humanism Honor Societies. And we were able to celebrate induction of our own students into both of these programs this past year. While I've already touched on some of our 2021 grant funding, I've not acknowledged all of the research endeavors within the school. Some other examples of our research include the use of stem cells to regenerate cardiac tissue damaged by heart attacks. That effort is led by our chairman of internal medicine, Dr. Buddha Dawn. The effect of marijuana use on fetal growth, causes and costs of motor vehicle accidents, pediatric disaster preparedness, severe pavement burns as they relate to ambient temperatures, and burst spacing and how it affects a mother's recovery. We also currently have clinical trials running. Research is happening throughout the school among our faculty, residents, and fellows and students. This has led to over 440 publications from the school since 2015. Just in the past year, the emergency medicine department has accumulated 8 peer-reviewed manuscripts, 5 additional publications, and numerous abstracts and presentations at regional and national conferences. Our surgery department alone has had over 28 publications. We have Dr. Edwin O., who received the Office of Undergraduate Research 2021 Outstanding Faculty Mentor Award. Dr. O's research is really changing the landscape. Dr. O looks at wastewater to look at prevalence and the serotypes of the COVID virus infection. His work has led directly to changing public health methods and procedures as we have dealt with the pandemic. And showcasing our robust undergraduate medical education research program led by Dr. Neil Netsky, we recently featured Vlad Zitny, a class of 2022 medical student who's had many papers, many more than most medical students. And we congratulate his achievements and really the achievements of all of our students as they fulfill their research and scholarly requirements. The GME Education Office supports residents and fellows and has funded 46 residents and fellows to present their research at regional and national conferences. Dr. Laura Shaw with Dr. Justin Jeffries are continuing to work with individuals exposed to the radiation fallout from atomic testing in Nevada. The OB at Kahn department has received a family planning grant, which provides family planning services such as birth control and family planning education. This grant was recently renewed and serves 144 women, with the number expected to grow to over 300 women in our community. For their work, Drs. Deborah Cools and Ms. Laura Grider and the team of passionate faculty, staff, and student researchers have worked on grant funding through the Nevada Office of Traffic Safety. For their work, they've been honored as a Nevada Zero Fatalities May 2021 Traffic Safety Champion. I don't have to tell you that traffic safety is really an important issue for our region, and research done right here at the Kirk Kerkorian School of Medicine at UNLV will hopefully work to reduce this significant public health hazard. Research is one differentiating component of academic medicine. Embedding research in the education and practice of medicine is of tremendous benefit to the patients we treat and allows us to deliver evidence-based, innovative centers of excellence in medical education and research, coupled with cost-effective, high-quality care that improves the health of our community. And I can't talk about patient care without discussing UNLV Health, our affiliated faculty practice plan, formerly known as UNLV Medicine. Having undergone a rebranding and several leadership changes, UNLV Health continues to serve our diverse population by providing primary and specialty care services, including services that are only available through UNLV Health. It was UNLV Health that led the efforts to do curbside testing. It was UNLV Health that led our efforts at vaccination. And it will be UNLV Health that continues to be on the front line contributing to the care of our community. We also provide for the community in other ways. For example, our surgery department has had over 52,000 patient encounters. Our ENT, head and neck surgery department, has had over 18,000 patient encounters. OB-GYN has had over 34,000 patient encounters and has delivered over 2,250 babies. The Mojave Counseling Clinic, which recently celebrated its 30th anniversaries, continues with great success connecting with patients by telehealth and in-person visits. The team, consisting of psychiatrists, nurse practitioners, medical assistants, registered nurses, pharmacists, pharmacy techs, psychotherapists, day treatment counselors, case managers, front office specialists, and a variety of other important support staff, engage in over 11,500 clinic visits, over 5,000 psychotherapy sessions, and over 780 counseling sessions. They also completed over 56,000 hours of case management and over 1,400 hours of day treatment group. Now, we know as we come to the other side of the pandemic, mental health and behavioral health concerns are going to be huge. I know through my experience going through Hurricane Katrina in Louisiana that these mental health issues are really pervasive. Our psychiatrists, our psychologists are really in the front line in helping to manage this very, very important part of healthcare. At University Medical Center, a team of psychiatry faculty, residents, and fellows had over 4,200 encounters in 2021 with patients with acute psychiatric needs in all parts of the hospital, including the emergency department, ICU, burn care, and other areas. Our physicians and residents are providing services in our clinics as well as in community partner clinics, ambulatory surgery centers, and the University Medical Center of Southern Nevada, Sunrise Hospital, the VA, and Nevada Healthcare System, Optum Care, Orthopedics and Spine, Grant a Gift Autism Foundation, Ackerman Center, Silver State Pediatrics Skilled Nursing Facility, and many other community partner locations. Moving forward, we're looking for many other community partners to engage and continue our mission to care for our community. In February, UNLV Health's family medicine and sports medicine clinics partnered with the Living Heart Foundation to provide physicals to NFL retirees during Pro Bowl weekend. And that included screening for traumatic brain injury. Sports medicine's Dr. Wade Gaw continues to serve as a head team physician for UNLV Athletics, and with Dr. Glenn Barnes supports several other Las Vegas sports teams, including the women's NBA's Aces, Vegas Golden Knights, Silver Knights, Aviators, and a variety of other teams. Our doctors have been on the front line in various capacities, responding to the COVID pandemic. Despite the challenges healthcare organizations across the country faced, our emergency medicine department became leaders in crisis management. They're able to reduce the number of patients leaving the emergency department without treatment to less than 1%, the lowest amount really in a 5-year period. And that was all done in the midst of a pandemic. Again, as COVID restrictions have eased and social events have resumed, our emergency department has been there to coordinate out-of-hospital care for multiple gatherings, including events at Allegiant Stadium, the Las Vegas Golden Knights games, the Day in Vegas Festival, the Electric Daisy Carnival, where in fact the life of a hyperthermic patient was saved. And our Center of Individual, Couple, and Family Counseling continues to provide services to students and the community members through easy-to-access telehealth in 2021, while providing internship and practicum opportunities for students. In 2021, the clinic provided over 4,600 sessions of low to no-cost services. Many members of our faculty have been recognized in the past year for their talent, skills, and dedicated to the practice of medicine. For example, Dr. Evelyn Montalvo Stanton received the Healthcare Headliners Honoree Award from Vegas Inc. Dr. Sadef Fakra was accepted into the American College of Cardiology I Am Women in Cardiology program. Dr. Annabelle Barber was named Vice Chair of the Best Practices Work Group of the Board of Governors for the American College of Surgeons. Dr. Ovank Bardashoglu, Dr. Mario Gasparda Alba, Dr. Ken Azora, Dr. Aditi Singh, Dr. John Veris, Dr. Sandy Wahi, Dr. Nadia Gomez, Dr. Eric Kubiak, Dr. Matthew Eng, Dr. Robert Wong, Dr. Rebecca Scher, Dr. David Dijon, Dr. David Parks, Dr. Michael Scheidler, Dr. Beverly Nyland, Dr. Fatali Pira, Dr. Dodd Semenga, Dr. Richard Benosa, Dr. John Menezes, Dr. Allison Netsky, Dr. Johnson Kay, Dr. Annabelle Barber, Dr. Jennifer Benosa, Dr. Dan Kurgan, Dr. Deborah Cools, and Dr. Randy St. Hill. Very long list. We're all named top docs. We're all named top docs by Desert Companion magazine. I'm really proud to say UNLV Health, our physicians, are really making a difference in healthcare in Las Vegas. Dr. John Brocious, Dr. David Dijon, Dr. Mitch Foreman, Dr. Josh Goldman, Dr. Eden Lee, and Dr. Matthew Eng were all named top docs by Vegas Inc.'s Healthcare Quarterly. And Dr. John Files was selected by the National Association of Emergency Medical Technicians to receive the 2021 Dr. Norman McSwain Leadership Award. Now, ironically, I knew Dr. Norman McSwain prior to his death at Tulane. Dr. McSwain was a recognized expert in trauma care. He was a recognized trauma member. He was a valuable member of our community. And I think John Files truly embodies those same traits found in the late Dr. Norman McSwain. Dr. Ken Azura was invited to be on the editorial board of the journal Endocrine Practice, the official journal of the American Association of Clinical Endocrinologists. Dr. Boone Dawn was appointed as a section editor for cardiovascular regeneration for Stem Cell Reviews and Reports, a Springer Nature journal. Dr. Jordana Haber was recognized by the Academy for Women in Academic Emergency Medicine with the 2021 AWA-EM Catalyst Award. Dr. Robert Wong is recognized as a Castle Connolly Top Doctor and a Nevada Magazine Top Doctor in ENT. Dr. Josh Goldman was honored by Las Vegas Weekly as one of the city's 40 under 40 for 2021. Dr. Ori Kasasaka was selected as a fellow for the Well Leadership Initiative. Dr. Kate Martin was appointed as a fellow with the Gerontology Institute of the University of Massachusetts, Boston. Dr. Robert Wang was invited to be an oral board examiner for the American Board of ENT. Dr. Alyssa Palmer and Dr. David Weissmiller were honored as top family practitioners by Nevada Magazine. And I was also recognized as a medical professional of the year by Nevada Biotechnology and Health Science Consortium. My gosh, I'm starting to get dry in the mouth, and I'm starting to get tired with all these announcements, other than to say, our faculty are really a very important resource for us, and we're doing very, very well. I can't be proud enough of our faculty, and I'm sure that faculty listening, I may have left one or two of you out. If I did, please let me know by email, and I'll make sure to make the appropriate announcement. I'm really proud of everyone who's done so much to enhance the health and well-being for our patients. In addition to clinical services, we support our community through all areas of the school. Nevada Community Service is embedded into our undergraduate medical education program. Our faculty, residents, fellows, and staff serve in leadership and advisory roles throughout local hospitals, Clark County Medical Society, Volunteers in Medicine of Southern Nevada, and numerous other groups. For example, Dr. Alyssa Palmer was reelected as Chief of Family Medicine at UMC, and Dr. David Kuykendall was reelected as Vice Chief of Family Medicine at UMC. Dr. Palmer serves on the board of the Clark County Medical Society, and Dr. Aaron Rogers serves on the Nevada Academy of Family Physicians Foundation as a trustee. Through grants and other programs, we continue to expand our services to the community. For example, the Psychiatry and Behavioral Health Department is responding to Nevada's mental health crisis with a pediatric access line, providing primary care physicians across the state telephone access to child and adolescent psychiatric consults. They also have a first episode psychosis program, which continues to grow. We all serve on school, university, community, state, national, and international committees and boards. We all openly share our research, knowledge, and talents with the world in an attempt to improve our collective future. GME, with the UNLV Health Science Library, Office of Diversity, Equity, and Inclusion, and our Well-Being Program, collaborated to sponsor a diversity in medicine storytelling event, which was led by the GME committee, headed by Dr. Aditi Singh and Dr. Ori Kasasaka. Faculty development sessions on implicit bias have been developed and presented. I can't say enough about our commitment to diversity, equity, and inclusion. Our Associate Dean for Diversity, Equity, and Inclusion is actively recruiting an Assistant Dean in recognition of the great need in this area. We need to be leaders in this field, and we need to train physicians that mirror our community. It's really essential to what we do, and let's face it, diverse groups are better at solving problems. There are lots of problems in our community, and these diverse groups that we put together, the diverse students that we recruit and train, will help us all solve problems better. Dr. Alyssa Palmer chairs and teaches women's health for the American Academy of Family Physicians. Dr. David Weissmiller chairs and teaches board review courses for the American Academy of Family Physicians. Some other physician accomplishments: Dr. Joe Biggis was invited to speak at UC San Diego Symposium on Head and Neck Construction. And I could go on and on and on with really praising our faculty. We're small, we're getting bigger, and we're already making a huge impact. We've achieved so much in our short history, but I don't expect us to be slowing down anytime soon. This is really a wonderful time to be dean of the Kirk Kerkorian School of Medicine, part of UNLV and part of our community. As I wrap up my second year, I'm happy to have this moment to reflect on all we have done before we resume activity on the many projects we have underway and begin working on new ones. We're going to continue to recruit and hire key positions to support our growth, including, as I mentioned, the recruitment of an associate dean of research and an assistant dean for diversity, equity, and inclusion. We're living our values of striving for excellence, driving innovation, serving with compassion and humility, demonstrating inclusion, and acting with integrity. We continue to expand our current efforts and are developing new mechanisms to increase the diversity of our student and faculty bodies. Again, we've talked about our Office of Diversity, Equity, and Inclusion. They have programming that recognize Black History Month, Women's History Month, Hispanic Heritage Month, and many more. Again, we also have a pre-med program where we try to recruit the next generation of physicians for our community, with a particular emphasis for making sure we have a diverse and equitable workforce. As part of the president's UNLV Top Tier 2.0, myself, along with the other Division of Health Sciences deans, Dr. Angela A. Marr from the School of Nursing, Dr. Ron Brown from the School of Integrated Health Sciences, Dr. Lily Garcia from the School of Dental Medicine, and Dr. Sean Gerstenberger from the School of Public Health, including representatives from our mental health training programs, Dr. Michelle Paul, Executive Director of the UNLV Practice, and Dr. Sarah Hunt, Director of UNLV Mental and Behavioral Health, and Assistant Dean of Behavioral Health Sciences, along with our strategist, Mr. Victor Way, are really working to advance the concept of academic health. An academic health center is really unique to our community. Nationally, academic health centers do several things. Firstly, although they comprise only about 6% of healthcare organizations, they're responsible for over 40% of charity care. Again, our mission is to care for our community. We're not going to turn people away, and we are going to care for everyone. The other thing an academic health center does is it brings coordinated care. Let me give an example. I'm a hematologist oncologist, and the way an academic health center practices oncology is somewhat different. It's one-stop shopping. A patient may come in with results of a biopsy of a breast mass, and in one setting, they can see the medical oncologist, the surgical oncologist, a plastic surgeon for reconstruction, a radiation oncologist, representatives from behavioral and mental health, and a whole host of specialists all at one time to plan a treatment course that's evidence-based and that's value-based to provide the very, very, very best care for our patients. With the other schools in health science, we're working to create and build the academic health center for the future for our community, for Las Vegas, and for our university. We're continuing to address patient needs by adding new practitioners and clinical support staff. UNLV Health is expanding services, adding new ones, and we're actively engaged in patient access and being better at what we do. We're committed to growing our programs, partnerships, and exploring opportunities to expand our services within our community. With the strong leadership team we've developed, the new hires who have joined our UNLV family, and the ones to come, I'm confident I'll be back in front of you next year to tout many more successes. And with that, I really thank you for your time and attention. This is truly a team effort. This requires the work of many individuals. I've singled out a couple people in this talk. For those I left out, I apologize, but each and every person on our team is important. Again, our big mission is to care for our community. This takes a village. You're the village that's going to do this, and we're going to make a difference. I thank you for all you do. Thanks for your time and attention.